Good afternoon and welcome to today's press conference. My name is Dan Petticourt. I'm the Public Health Director for Contra Costa County, and I'm joined today by Dr. Ori Savelli, our Medical Director of Public Health and Deputy Health Officer, as well as Anna Roth, our Director of Contra Costa Health Services, and our County Administrator, David Twa. Last night, three additional Contra Costa residents tested positive for novel coronavirus, also known as COVID-19. Two of these were from the Grand Princess cruise ship that returned to the Bay Area from Mexico on February 21st. The same ship, as you might know, is currently harbored off the shores of the Pacific with a different group of passengers. The third person had contact with a known positive case from a neighboring county. All three are under home isolation and don't require hospitalization. Public Health is monitoring the health of these people and ensuring they follow CDC guidance. Public Health staff is conducting ongoing contact investigation for these cases. These cases demonstrate that our public health efforts to identify and monitor known exposures is working. This now brings the total to 4 county residents who have tested positive for COVID-19. The first person, who was reported earlier this week, is in critical condition at a local area hospital. I'll also refresh a previous update. Only one of the 4 travelers associated with the Diamond Princess cruise ship, these were passengers that were processed through Travis Air Force Base, remain in a Contra Costa hospital. That person who did test positive is doing very well and quite anxious to go home. We should anticipate that in the coming days and weeks, more cases will be identified. It is unclear how our first case of community-acquired COVID-19 was exposed to the virus. Unlike the other 3 cases, this person had no travel history or contact with another known case. This is why we are recommending the community take the steps we are about to discuss to limit risk to COVID-19, particularly people who are most vulnerable to the illness. I'll also update that we are now testing for COVID-19 at our county public health lab. We have received more than 300 test kits from the CDC and have capacity to meet current demand. We have also offered assistance to the state in testing those passengers that are on board the Diamond Princess cruise ship that I commented on earlier. I would now like to hand it over to Dr. Ori Savelli.
Thanks, Dan. My name is Ori Savelli. I'm the Public Health Medical Director and one of the Deputy Health Officers for Contra Costa County. Contra Costa Health Services is now releasing new recommendations to try to help to protect the most vulnerable patients in our community from novel coronavirus. These guidelines are for people who are at highest risk of becoming seriously ill. Those are people over 50 and people of any age who have chronic medical conditions such as diabetes, cardiovascular disease, cancer, lung disease, and immunosuppression. People at higher risk should avoid mass gatherings such as concerts, sporting events, or parades. This advice does not apply for people going to work in an office building or going to the grocery store or the mall, places where people can usually stay more than an arm's length away from another. Facilities caring for seniors or medically vulnerable patients or people should cancel large gatherings such as bingo nights, movie gatherings, etc., and should be very vigilant about cleaning and screening visitors for illness. We are not recommending school closure at this time. Public Health will update school districts on a conference call on Monday. I want to remind people of some of the best ways to help protect themselves. Wash your hands frequently with soap and water or use a hand sanitizer. Avoid touching your face. Frequently touch surfaces or doorknobs with regular household cleaners. Those work fine. If you are sick, stay home from work or from school. The other thing to remember is when you're sick, contain your sneezes in tissue paper or sneeze or cough into your elbow. And remember, masks are for sick people. There's no evidence that wearing a mask reduces the risk for a healthy person from becoming infected. I'd now like to pass it off to our health director, Dr. Anna Roth.
I'm not a doctor today, I'm
Yeah.
a health director. Thank you for being here today. And as you've heard, there are early signs that coronavirus may be circulating in Contra Costa County, but there is still a lot that we can do. I want to focus today on a few things. The first thing is I want to ask people to focus on facts, not fear. There's information and guidance out there, and there's a lot, and it's changing quickly. We will be keeping you updated. We recognize that we're asking people to take steps that are to some disruptive and may be disruptive in their lives. We're only asking the public to do steps that we believe will have a positive effect on reducing community risk from the coronavirus. We know we're all concerned about coronavirus, and we need to do things to keep our families safe. We're asking for you to think and from a place of reason and not rumor. Credible information is very important right now. We're in this era of social media, it's really important that we use trusted sources like cchealth.org. cchealth.org also has links to the CDC and California Department of Health, or CDPH. Also remember that the vast majority of people that you might encounter with COVID-19 will not become seriously ill, and most will fully recover. We do expect more cases in our community, so let's not fear get the better of us, and let's not stigmatize. This is our community, and this is a time for us to look out for each other, not try to figure out who we need to stay away from. So I want to summarize that with, we really want you to focus on solidarity and not stigma. We've seen some unfortunate examples of that in other parts of the world. We do not want to see that in Contra Costa County. Now is the time for preparation, not panic. We're working with all cities, schools. We have all branches of our county government working together. We're monitoring and communicating daily with the CDPH and CDC. And we and all of our partners will continue to update any advice or guidance for any particular groups in our population, and we'll keep you posted. Thank you for coming today, and if you have any questions or you want to talk with any of us, we're happy to take your questions now.